I think I've answered really most of the most common questions I get. I mean, some bits around affordability, and we use Signature RX, which is a prescription that goes to your phone. That means you don't part with the prescription. It allows you to shop around. The bigger multiples or some local pharmacies really do have prices that are quite different. Just today, I had one patient where there was £90 different between the online pharmacy and the local pharmacy it normally goes to for his injection. So I think that's important from a financial point of view. The other question I also often get asked is, what happens if I get stuck? What that means is, what happens if the weight's not lost anymore? It may be that if you're on a semaglutide, we would change you across to the Mounjaro type medication. It's meant to lose a little bit more weight. We are waiting for the new products to get licensed in the UK. The tablet form, which is not available yet, allows you to maintain your weight loss. The new injections, which are called Glp-1Xs, are meant to achieve slightly higher weight loss. Those drugs have not been licensed in the UK. They have been licensed in the US for about a year, so they should come here soon. One of the benefits of allowing drugs to be licensed elsewhere is that if there are any unacceptable side effects, we'll know about it before they're released, or they won't be released at all. So far, there do not appear to be any unacceptable side effects. What's quite interesting about GLP-1s is that they seem to have an anti-inflammatory effect, and therefore they're beginning to be used elsewhere. I had a patient last week who asked whether he could start a GLP-1 with Crohn's. We spoke to a specialist because it's often said that it would be contraindicated. We phoned up a consultant, St. Thomas's. In reality, the anti-inflammatory effect may help as long as you manage the risk of constipation that obviously can cause problems with inflammatory bowel disease. There isn't a reason why you would not start with something like Crohn's if the weight loss actually may help the Crohn's itself. There are patients coming out with endometriosis with prescriptions for Mounjaro, and there are some patients that I've seen on Mounjaro who have said they've had a good benefit in reduced pain due to a reduction in inflammation from their pelvic problems. So I have a funny feeling that we will get these used more and more in the future. Professor Deanfield published a paper which said that there is an association between Mounjaro and reduction in heart attack and stroke, irrespective of weight loss. There is another paper that I've read that says it reduces the risk of renal failure. I have a feeling there'll be a lot more said on these drugs going forward in the future.